Hi, Dr. Maria Nagy here, and I was going to do a presentation for you. This is the VC pitch that I've been doing these last 2 weeks, and I decided I was going to go ahead and do it for you guys because there is a lot of information that I seem to never really get to. I always talk about the COVID test, but I never really talk about what the entire company was built on and what kind of technologies we have coming down the pipeline. That science is actually pretty exciting. So I'm going to go ahead and pull up my pitch deck here and share it with you. So I suggest go get a bag of popcorn and a drink and sit back and relax because it's going to be a long presentation. But I appreciate your time and I appreciate you being here and taking time out of your day to watch this presentation. All right. So as I'm waiting for this to come up, there we go. All right. So as you know, my name is Dr. Maria Nagy, and you got my PhD from Georgia State and graduated in 2010. And my love and my passion and the work that I was doing while at Georgia State was looking at bacteria and how they communicate. And they communicate using these bacterial signals. And since when bacteria attack the body, they don't attack as single planktonic units, they attack as an army. And since they can't see and they can't hear, they will coordinate using these chemical signals in order to identify, quantify, and deter and coordinate their gene expression. So that was my love and my passion. And I read one journal article and I knew from that journal article how to develop a whole new line of diagnostic products. But in 2010, I had no idea of, how to start a company or anything like this. So I just kept looking for big companies. Oh, when the big company does this technology, I'll go work for them. And I kept looking and I looked. And for 6 years, I was looking for a big company. During that time, I did academia, I did research, and I worked in industry as a quality supervisor. And my last job, which ended in 2017, I had stacked up a bunch of cash because I was making an adult income. And it turned out to be a perfect storm. The stupid idea of this diagnostic had not left my head. I couldn't find a company that was working on it. I had just stacked up a bunch of cash and my contract ended. And I was like, oh, one other piece of the puzzle. I saw Y Combinator and on YouTube. And then I just started binge watching like probably 200 hours worth. I'm not kidding. Y Combinator and Harvard and Yale and Wharton Business, anything to do with a startup, I just obsessed. And that was the spark that set the whole thing off. And then in 2017, I started the company. Subsequently, a little while after that, Dr. Angel Rivera came and joined the team. And we've just been going like a motorcycle, just and developing, and it's just been a fantastic ride. Okay, so that's my story. So now let me get into the science. Anyway, so in 2017, I started the company and we started developing a technology for a fast test for Pseudomonas pneumonia. And we were using this bacterial quorum sensing as a way of developing that technology. Well, as I was getting ready to take that technology and fundraise for it in January of 2020, we all know what happened. The entire world stopped. And in March of 2020, I look at Angel and or Dr. Rivera, and I'm like, dude, we've got to do something for COVID. We know how to do a lateral flow. It's our responsibility almost to step up and to do this. So then we went on this long journey where you guys came in, you know, in whether it was in the summer of 2020 or if it was in the summer of 2021 or just around the corner. That's how we got to here. Okay, wasn't going to talk that long, but yeah, that's the story. So here we go. So, okay, well, you may say, oh, well, guys, you missed it. You're late to the game. Well, we may be late to the COVID game. It took us a little longer to develop everything than we thought. You know, but the game's not over. You know, we may be late, but the game's not over. Let's look at the UK over here. The UK is a pretty good indicator of what's coming down the pipeline for the US. In January 7th of 2022, they had by far the highest number of cases they have had this entire pandemic. That's 227,000 cases in one day. And considering they only have 67 million people, that's a whole lot of cases. Okay, in terms of January 27th, 3 weeks later, is when they had by far the highest death count of 1,297 people. So we're typically about a month to a month and a half behind UK. It seems like this one is slowly creeping up. It's creeping up a little slower than Delta did, but it's coming down the pipeline. I hate to say it. But let's say, you know, even as we're going from pandemic or endemic, people are always going to want to know if they have COVID. You know, if COVID does become the new flu, well, the rapid market for flu tests is 423 million. That was in 2018. So 423 million dollar market is not so bad. However, the actual whole diagnostic market, they project to be 195 billion by 2027. We now know people are getting comfortable and really like having these at-home kits to, you know, to take their health into their own hands. And, you know, we want to be a part of that, right? So moving forward, let's talk about the product briefly. So it's a lateral flow stick. It's 4 minutes, which is 2.5 times faster than any other test in the market. We also developed a phone app from the ground up that is going to collect de-identified data about what's really going on. You've got all these tests like the Binance now and the Quidel, and that's great. You know, people are protecting themselves, but we don't really know what's going on since, you know, those numbers are not necessarily getting reported. So, but anyway, we're going to have our own data set of numbers that we will be collecting. No names, anonymously, but we will be collecting that information that I feel will be very helpful down the line. Okay, with the phone app, you're going to be able to have a report that you can share with friends and family or as you see fit. We also have a button that will connect you immediately as an optional service to Physician 360, our telemedicine partner, because some people want to know, they want advice as to what to do according to their symptoms. We also have AI technology. So what the AI technology does is it looks at the lateral flow sticks, it measures the intensity of the two lines, and then it will spit out an answer as positive or negative. And we're finalizing that technology now. So other than the the potential cases that are coming down the pipeline. Why else should we be focusing on getting this product to market at this time? Number one, this is the fastest time to get through FDA. It's still not easy, but it is definitely faster. If you have your ducks in a row, you can get approved with a product in as little as a week. Now, if they kick it back, then it's going to take longer. It can take up to a month for them to review it and tell you what you've done wrong. And we've experienced that, right? And so not only that, the approval will allow us to develop brand recognition. It will allow us to build out both our supply and our distribution channels, and the revenue from this product will springboard us for the rest of our pipeline. And then plus, we can help a ton of people with a superior product. We really do think our product is superior, and there's always room for a superior product. Okay. Okay, so how are we different? Number one, we're looking for the spike protein when everyone else is looking for the N protein. So if you look down here in the bottom right-hand corner, you'll see we've got our little spike. We've got our SARS-CoV-2 virus. On the end right here is we have the spike. This is kind of like the key that binds to ACE2 receptor. This is the spike, and we have developed our antibodies. Well, we haven't developed the antibodies, but we've developed the test to recognize the highly conserved region of the spike protein. If this were to break or to change or mutate, then it won't be able to bind to the ACE2 receptor anymore. The other guys, what they have to do is their tests have to crack open the virus. So you're using some kind of compound called sodium iodide to crack it open, and then you're looking for the proteins on the inside called the N proteins. With ours, you don't have to do that. You don't have to use any caustic chemicals. We're just using the saline. We've tested across and paid attention to all the variants, and just got a report back a couple of days ago that ensures us that we can pick up both Delta and Omicron variants. Our accuracy is 98%, our sensitivity is 94%, and our specificity is at 100%. We filed 3 different patents for this particular lateral flow stick. All of our components have been customized based on our customer feedback and made to be optimum for not only the test, but also the experience. And we also were thinking of the pipeline downstream. So many of these components will be washed, rinsed and reused down the pipeline, literally, not literally, figuratively speaking, as we are developing the rest of our technologies. So let's talk science. Okay, so the first question typically on these tests is, what is our limit of our detection? And we have 1.25 virions per microliter, and that was done by P23 Labs. We are now going back and reconfirming that data using UGA. But what that tells us right here is you've got a positive and you've got a negative right here. When we compare this result over here to, this is PCR, and some of you guys, I'm sure, have not seen a PCR chart before. So PCR, you take a small piece of RNA and then you amplify it and amplify it and amplify it in an exponential fashion. So the question is, so what the PCR does is it reads the RNA as soon as you hit a certain threshold, and then the reader can pick up on this RNA. So The lower you have, like 16 and 17, the more infected you are. The more times you have to repeat this little bit of RNA, the less infected you are, because you have to replicate and replicate and replicate before the scanner can pick up on the information. So CDC has said that 40 is the cutoff. So if you're 40 and above, you're negative. If you're 40 and below, you're positive, right? So our most infected patient turned out to be this gentleman right here. And he had a CT of 22. Mind you, this patient had 0 symptoms. So, but he was walking around. He's like, oh, I'm coming in just to help you guys in your clinical study, but I'm fine. I've been tested already. So he ended up coming in extremely positive. And then our most sensitive one right here turned out to be 37.5. So those are pretty good results. Moving on, we have more data than we could ever present in one presentation. But if you would like me to go through all the nitty-gritty data, just please reach out to me and I'll be glad to discuss that with you. But in terms of clinical performance, what we did was we looked at 252 patients. For the clinical, so we've got your clinicals and then we've got your usability. Your usability is how easy is it to use the components in your kit. And the clinicals is how well does it work. So in our clinical studies, we looked at 252 participants. They were between the ages of 18 to 72. 210 of them were asymptomatic. That's 83%. And 42 were symptomatic, coming in, sneezing and coughing. 194 self-swabbed, and then 58 were assisted, whether it's a parent assisting a child or parent or a person swabbing their mate. We went to a whole varied group of locations, including 2 gyms, plenty of homes, manufacturing facilities, thrift stores, community centers, etc. Our sensitivity, out of 34 positives that we collected, we caught 32 of them. So that puts us in a 94% sensitivity in terms of specificity when we're looking at the negatives. We caught 217 out of 218. That's 99.5 or 96% specificity. When you're looking specifically at symptomatics, that's 100%. When you're looking at the positive predictive value, out of positive, what's the probability of getting positive? That's 97%. And the negative predictive value, negative out of negative, is 99%. Our PCR was done with an outside laboratory called Omni International, and our statistics were done by an outside company called Stat1 coming out of North Carolina. So what about the competition? Yes, let's focus on the top 4. You've got Abbott, Ellume, Quidel, and Lucerna. The way that we're different is we have a phone app, but our test can be read with or without the phone app. We also have AI technology, and we have the optional connectivity to Physician 360. In terms of our sensitivity and specificity, we are hold up to all the other tests on the market. And then of course, we will be coming 2.5 times faster than any other test. What's the market opportunity? Like I had said before, they project the diagnostic market to go to 195 billion by 2027. So what's the market opportunity in the US? How are we going to calculate that? If we look at 300 million Americans, let's say 10% of them are testing, that's 30 million Americans that are testing 2 to 3 times a week. They're still screening, just as Dr. Fauci has mentioned. That's an anticipated demand of 60 to 90 million tests per week. If QXD got 1.1% to 1.7% of that anticipated market, we will have hit our max capacity of 4 million units, 4 million units a month. There is a chance that we can go all the way up to 10 million units, but let's just stay with the 4 million for now. The insurance reimbursement that is presently seen is $12. So if we sell our kits somewhere between the $12 mark and the $37.50, where we see Ellume selling their kits, if we sell somewhere in between that for 1 year, that's a 576 million to 1.95 billion opportunity. Our EBITDA would be between 450 million to 1.56 billion for 1 year. So from a math standpoint, there is reason to still be in this COVID game. Not to mention Biden wanting 1 billion tests. So how are we going to get this sell the 1.1 to 1.7%? We've got 3 go-to-market approaches. Number 1, we have already built a Shopify website. We're just waiting to launch. Number 2, with our partnership with Physician 360, they have access to 1,000+ drugstores nationwide, so we can get our kits nationwide in these drugstores within weeks of approval. And then lastly, we have 4 salespeople that have been patiently waiting in the background, and they will focus on industry, because there are still a lot of industries and hospitals and such that need rapid tests. Okay, and who's the team to get it done? I surrounded myself, or I have been honored to have this fantastic team around me. Dr. Angel Rivera has published over 80 papers. He's an MD, PhD, with his expertise being in gene therapy, oncology, and virology. And then we have Mr. Mark Kopsel, with 44 years of international business. We've got our 1, 2, 3, 4, and 5 advisors. And so these 5 advisors are, from the science standpoint, they're all MDs or PhDs. And then with Bill Suarez being our, and Azad Rahman being our business expertise. So in terms of business, we have over 100 years of experience with these 3 gentlemen. In terms of science, we are covered with Dr. Navi Jita and Mr. Eric Woods. But that's not the end of the story. We're not just a COVID company. We've got a pipeline. I told you my dream of using these quorum sensing compounds. So let me tell you what we have coming down the pipeline. These are all quorum sensing related diagnostics, and I will go into what quorum sensing is here in just a minute. So this is kind of part 2 of our presentation. Number 1, we've got the fast test for Pseudomonas pneumonia. Like I said, we already have a working prototype for that. We've got designs for a rapid yeast, rapid BV. And then we have designs for bronchitis UTI, a multiplex pneumonia, and we're exploring flu COVID because there is a need. Okay. But flu COVID would not be a quorum sensing product. Okay, so what's the problem? What's the problem? The problem is that in hospitals when it comes time to testing. How are people testing, like for, say, Pseudomonas pneumonia? They typically do something called a culture test. This culture test can take between 3 to 5 days to do. Other times they use a PCR. It can take an hour and a half to 6 hours. Because these take so long, they're expensive, coming in between $85 and $250. They both of these testing require a highly complex lab. You can't do it on it's not a simple lateral flow. You've got to have equipment for the PCR, a piece of equipment the size of a mini computer, or a mini old school computer, which costs approximately $40,000. Because of urgency, sometimes they need to get an answer quickly. These doctors need to get an answer quickly. They can't wait 3 to 5 days. They can't wait on the backup. They can't wait for the samples to get sent to the lab. So what do? They do the educated guess, or they use empiric reasoning in order to determine how to treat the patient. And right here is an example of what this type of flow chart that they go through to decide what kind of antibiotic or what kind of treatment to give. We think we can do better. We can do better than for having doctors having to go through this process. So what happens with the educated guess? They don't know what's causing the infection. So oftentimes they prescribe something like a drug cocktail of various different antibiotics, right? So what's the problem with that? Number one, there's adverse side effects. Number two, you can have these really bad, really risky and dangerous C. difficile infections caused by excessive antibiotic usage. And number three, we got the development of superbugs, which is becoming a huge problem. Here's a real life case example. My friend's child, this girl that works at the lab, she had a 2-year-old with pneumonia-like symptoms, 5 days, high fever, severe cough, and vomiting. She takes her child to the doctor. They say they don't do a test. They don't do a culture. They don't do a PCR. They do an empirically decide, all right, well, let's put the child on amoxicillin for 10 days. A week later, the symptoms have reoccurred. There's still a bad cough. There's vomiting, high fever, inhaler, steroids to help reduce inflammation. 2 days later, now we have blood in the stool. The steroids are suspended. Let's tack on even more antibiotics. Cendefir for another 10 days, plus azithromycin for 5 days. So finally, after the third antibiotic, 2 days later, the child was better, and he goes back into daycare. But what does that conclude? 30 days of treatment. Why? Because the pediatrician did not want to do a culture because the laboratories were backed up. This child had 2 x-rays within 20 days of each other. And they treated the child with this kind of experimental method of treatment. They went through 3 antibiotics before they found the one that works. We think we can eliminate these problems with a 4-minute test. We did it with the COVID test, and we can utilize these same test techniques for other tests as well. So these lateral flow sticks are cheaper, they're easier, they support antimicrobial stewardship. And we believe in our technology so much, we filed 5 international patents in US, Canada, European Union, India, and Hong Kong. So let me talk to you about this proprietary technology that is built upon the lateral flow. It goes back to this secret sauce that I was telling you about, the quorum sensing, hence the name of the company, QuorumX Diagnostics, right? So quorum sensing is a bacterial communication. When bacteria first get into the body, there's just a handful of them, and they need to kind of coordinate, decide where they are, kind of get established. So they start putting out these little beakers, beacons, like signals, right? And it's only at the same time the bacteria are doubling and multiplying like they do, and then they all start putting out the signal. And so when the concentration gets high enough, it creates a concentration gradient. It'll diffuse back into the cell and bind to DNA and trigger gene expression. So bacteria use these signals to, number one, to self-identify who's here, to determine if there's friend or foe around, to quantify, and then also to coordinate gene expression. We believe that these little signals would be the perfect way of identifying bacteria, because bacteria are using these signals to self-identify, right? So what are they able to do, or with these quorum sensing signals? The bacteria use this to trigger their arsenal of weapons, whether it be toxins, biofilms, efflux pump expression, bioluminescence, antibiotics, pigments, hydrogen cyanide, pathogenicity genes, swimming and swarming, etc. Think of this war that's going on, this terrible war. It's one thing to look and see the damage that's occurring, the bombs that are falling, and reacting to what you're seeing. But it would be a game changer if you sat in and started listening to what they're saying and what they're planning on doing, right? Just like an army, secretly listening to what the attacker is about to do. So this absolutely beautiful piece of artwork we borrowed from a group that got published in 2019, December 2019 in Science. So this artwork right here shows Pseudomonas aeruginosa right here as it's increasing in population. First, here's a number of different kinds of signals that they use. It's almost like a language, and each bacterial species has their own language. So Pseudomonas aeruginosa uses here 3-oxo-C12 homoserine lactone, and then C4 homoserine lactone. And then later on in their infection, they'll use these HHQ and PQS. And then over here, they're using piocinin, and they're using this PCA and PCN and other signals, right? And it's in a cascading effect. So if we can come down here when the concentration of these organisms is really low and identify what signals they're using, then we can say, we see Pseudomonas is there and it's getting ready over here to attack. And then you would be treating the infection differently, or at a minimum with a lower dose of antibiotic. That's the dream, right? And not only is Pseudomonas talking to Pseudomonas, Pseudomonas is talking to Staph aureus, and yet Pseudomonas is also talking to the human body. So it's like there's all these chemical signals going on, and if we can tap into that, it's a game changer of how we would be able to treat. So what can we do now? Because this is the dream, this is the North Star, this is where we're going, right? What can we do now? What is the low-hanging fruit? Well, we can identify and we can quantify. and we can produce a product that has value. Using this quorum sensing technique, we have developed the QXD1 fast test for Pseudomonas pneumonia. Pseudomonas pneumonia is caused by Pseudomonas aeruginosa, and it's the #1 and #2 cause of hospital and ventilator acquired pneumonias. It's also the #1 cause of cystic fibrosis pneumonia, and with immunocompromised patients, you see this Pseudomonas aeruginosa as well. For this particular product, we have built a working prototype. We have tested against 39 patient samples. Half of them were positive, half of them were negative. We caught the positive ones, and then we didn't, the negative ones that were infected with Staph aureus, Klebsiella, Acinetobacter, E. coli. We did somewhat of a mini cross-reactivity study, and those bugs did not interfere with our test. Like I said, we were getting ready to take this into small manufacturing run and to do bench work and to do clinicals in January of 2020 when the world stopped. However, this has been sitting on the shelf for 2 years now, and as soon as the opportunity is right, we will go back and pick this technology up, because this is the beginning of the dream to get to the North Star. Right? But this is a practical product that we could develop into a product that we could use now, and it would make a difference in many people's lives. What else do we have in the plan? How are we going to crack this $195 billion market? Obviously, like I said, with the COVID Now test, we plan on resubmitting that application in May of 2020 with a desired launch date of summer 2022. With this fast test of Pseudomonas pneumonia, while we have our business people focusing on the launch of this particular product, we will have a dedicated science team that will be working on the development of this Pseudomonas pneumonia. And we have a desired launch date of March 2023. After which we want to develop a rapid yeast BV test. I know as a female, I would have very much appreciated having a yeast test and bacterial vaginosis, similar symptoms, but vastly different organisms. With this quorum sensing, not only can you identify bacteria, but you can identify fungi, and you can identify some viruses. And there was a fantastic TED Talk that said this activity can also be seen in cancer cells. So the potential with this technology, with this quorum technology, is fantastic. So with the rapid BV test, we would be exploring the quorum sensing compounds in both bacteria and in fungi. And then later on, we will continue the development of pneumonia and go from the hospital and the ventilator and focus on community acquired and make a multiplex with a projected date of fall 2025. Then here's a whole list of a myriad of other bacteria and viruses that are on the antibiotic resistant list. And we believe that we could attack many of these viruses and continue using this lateral flow method and tapping into quorum sensing signals as a way of wash, rinse, repeat, and coming up with fast, efficient ways of identifying these organisms. So our present investment opportunity on WeFunder, you saw that I was raising, I think for, it says 387, 330 of it will be used for this retest that we're finishing up. And part of it will be used for the AI, the phone app, and then another 170K is needed for AI technology. Once we raise 3 million, we'll use $1.5 million for launch, and the other $1.5 million, I'm sorry, this is going to be 3.5 million, but the other $1.5 million will be used to develop that pseudomonal pneumonia. Later on, we foresee having to do a second raise of 30 million, and that will help cover 20 million will help cover working capital to develop the COVID kits, and then equipment so that we can start producing these kits and subsequent products in-house and not have to outsource. And then later on, using the last portion of that money to build the rest of our pipeline. So when would we be looking at acquisition? When would we be looking at acquisition? Because the quorum sensing technology is so new, we believe we're going to have to, it's probably going to take us another 5 years to develop at least 3 to 4, maybe even 5 products. And as we develop that, then we're actually going to be looking very similar to another company that had at least 5 products on the market, like Alair. And in 2016, Alair was sold to Abbott for $5.3 million. So if we're emulating any company, it's this one. But with the quorum sensing, you don't want to sell it too quickly because you want to keep the team together so that not only can we build these quick lateral flow sticks, but we can, in the background, learn how to identify and quantify and then eventually determine what their next move is. And then treatment would be completely different. Doctors would be saying, what's that patient's quorum levels? And I'm going to adjust the treatment according to what the quorum level is. And that's the dream. Thank you for your time. Please put any questions down below and I will be glad to answer them. And if you want to set up a time to talk, please just send me an email or call me on my cell phone. I am here to discuss any questions you may have. Thank you for your time. Have a nice night. Goodbye.